Good morning, everybody. Happy Saturday. Happy chilly February Saturday. Perfect for indoor sports, whether you're playing or watching indoor sports such as basketball. And that's what I'm here to talk about today. I'm from the West Coast originally, so I'm repping my Steve Curry, actually Steve Curry or Steph Curry. Actually, Dr. Miriam lent this to me. Thank you very much. I'm Dr. Lauren Dolan with professional PT and training in the Madison YMCA. And yeah, so let's get started. I'm here talking about a four-letter word that no basketball player wants to hear, and that's the word tear. So there's lots of different things that basketball people will have injured, such as like, tearing a muscle, tearing the Achilles. But today we're kind of focusing on ACL tears, which are so common in basketball, especially among youth athletes, that can be so devastating in terms of, you know, taking them out of their season and even out of their sport. So without further ado, I will start my presentation. Also, thank you to Morris Sussex Sports for restreaming this. We love those guys, and they are awesome with helping out all youth athletes in the area. So, like I said, I'm discussing how to prevent ACL tear injuries, primarily with basketball. I used to play soccer, just a little bit of a background in terms of not only why I'm so passionate about this topic, but also how I become a physical therapist. I played with Santa Clara University in college, go Broncos. And I also played a lot of different sports, whether it was multiple soccer teams, such as part of the Olympic development program, but I also played basketball as well, participating in track and field as well as snowboarding team. This isn't unusual for a lot of youth or high school athletes. And what that means is if you're playing lots of sports, whether it's the same sport or different sports, there's lots of activity causing overtraining and ultimately leading to injury. And that's eventually what happened to me. So I tore my ACL in the NCAA tournament, so I couldn't complete the tournament with my team, which was so hard for me to take. I was able to return back to my sport. However, I developed arthritis, which happens in more than half the cases of people that tear their ACLs. So ultimately, I had to stop playing soccer. So silver lining is that's why I became a physical therapist and why I felt really motivated to help people not only recover from these injuries, but just to prevent them from happening at all. And so that's why it's so important to, get a sports readiness assessment, not only to screen in terms of your risk of injury, um, but also to optimize performance. When I tore my ACL, in hindsight, what I know now is I was doing a lot of the same things, thinking like, okay, if I play my sport or practice my sport or do fitness more, I'm going to be better. When in reality, I really should have worked smarter, not harder. And we'll kind of talk about what those things are in just a few moments or later in the presentation. So, in terms of current research, ACL tears among youth athletes are continuing to increase. It's just such a epidemic. So, a current study reviewed all the other studies that are out there, and it ranked in terms of not only sport but gender in terms of what people and what sports are the highest risk. So the top one being girls soccer, boys football, girls basketball, gymnastics, and boys and girls lacrosse. Obviously, you do have some risk with whatever sport that requires some jumping, running, cutting to tear your ACL, but these were kind of the big ones. I put a star by girls basketball because in terms of female sports, that was one of the highest, or if not the highest, risk risk in terms of tearing your ACL if you're a female. And in general, females are 1.5 times more likely than male athletes to tear their ACLs, and that's across all sports. They did note that these injuries tend to happen in games and not in practice. So I think, yes, you're preparing, you practice like you play, or play like you practice, sort of thing. But it's when you're going at game speed, everything changes. And so we kind of have to look at what we're doing in practice or maybe outside of practice that might be contributing to these injuries. So I just kind of want to outline what I'm talking about today. And ultimately, if you want to learn how to prevent yourself from tearing your ACL, you have to answer these other three questions first. Like, how and why do these injuries happen, these ACL tears happen? If you understand that, you'll kind of know what I need to do to not only recover better from tearing your ACL, but also, prevent it from happening at all. So, how do ACL tears happen? The ACL is a ligament. It attaches bone to bone. We have ligaments, in all our joints, and it keeps the joint stable. So, the ACL is right in the center of the knee. You can kind of see in the lower image here, it kind of crosses from the back all the way to the front. What this ligament does is it prevents excessive inward rotation towards the middle, movement towards the middle, as well as excessive straightening. And when those motions happen all together excessively, that's when the ACL tears. And there's generally two circumstances when this happens. You can have a contact ACL tear or a non-contact. Non-contact being 90% of when ACLs tear. So when you're cutting, jumping, there's some movement mechanics that are happening that put you at increased risk of tearing your ACL just by being in these positions. When you tear your ACL, usually it's not just that, you injure other structures as well. So it's all what's called the unhappy triad. So that includes the ACL, the MCL, which is the ligament on the inside, as well as the meniscus, which is these little cushions here uh, in the knee on the sides. You can kind of see in the skeleton picture up here, this is when an ACL tear occurs, where the knee goes in, the hips rotating in, and then there's also usually a lot of hyperextension. So here's a video example of a non-contact injury. I'm going to slow it down, or a non-contact ACL tear. So I really want to slow it down so you can appreciate what that looks like. Because again, this happens at game speed. It's really fast. It's really, before you know it, all of a sudden you're like, okay, I did something bad to my knee and I'm not sure what. Okay, so we'll just make this big too. Let's see. So pay attention to his left leg here. So he's coming in, going up for a shot, and when he comes down, that knee's going way inward and rotating. This is a little different in that you don't necessarily get that hyperextension, but it can, obviously if there's one or two of those positions, you're likely to tear your AC. Sorry, just trying to get to the next slide here. Okay. So just to kind of break down why are we getting in these positions? What kind of puts people at more risk in terms of tearing their ACLs? So these are the top 5 reasons. The first 4 are things like intrinsic, like things within ourselves that make us more susceptible to tearing our ACLs. And I starred them because that's one of the reasons why females tend to tear their ACLs more than male athletes. And then the fifth one being things that are more extrinsic, it's kind of like outside, like our behaviors outside of our body, I mean, and why that's leading to more and more ACL tears, especially in adolescent athletes. So technique is important, that being your jumping, landing, pivoting technique, as we saw in the video, obviously trying to avoid these positions if we can. And you can also see in the image here on the right, this girl is trying to box out her opponent. And if you look at her left leg, that's also doing that kind of those positions that we want to avoid. Alignment plays a big role. So that's your hips relative to your knee. So in general, women have wider hips. So the knees like to go inward. Again, that dangerous position of tearing your ACL. Also ligament laxity. So Sometimes people, it's more genetics where they generally just have loose ligaments, and so they're more unstable and likely to tear their ligaments. This also plays a role in females in terms of menstrual cycle. So throughout the cycle, there's various ligament laxity. So certain times of the month, you're more likely to tear your ACL. And then the fifth one being those like things outside or behaviors that we do. Generally, not only with ACL tears, but injuries in general, there's an intensity in terms of like, how often you're playing a sport and how intensely and versus capacity mismatch. So capacity being like how much can your body tolerate? And so we're seeing a huge issue here with people coming as patients because what happens is there's more year-round play at younger ages, whether you're on a travel team at 7 years old as opposed to like 12 or 13. Also specialization in single sports. So, instead of kind of having different seasons and playing different sports, you're really only playing soccer or basketball year round. Also, you could play on multiple teams, whether, it's your high school team or your club team, you're doing a lot of the same activities year round at the same time. So again, that's causing a lot of overuse and kind of lack of active recovery or cross training, kind of causing these injuries, whether it's ACL tears or other things. So what do you do if you tear your ACL? So we put together at Professional PT Training a wonderful parent guide. I mean, this is helpful for athletes too because God forbid this happens. You want to obviously hope for the best, but be prepared for the worst. So I'm just going to share that in the chat here. Um, you can go to, or I'll put it in the image here, to playbetterwithpt.com and just kind of put in your information and we can send that over to you. Also, you can give us a call. This is our phone number here at the bottom, or shoot us an email and we're happy to send that over to you. It's just nice because it kind of takes it takes away the stress of the situation. It's very emotional, to see your child injure themselves and be taken out of the sport that they love. And so we thought, okay, if we give people a guide, that at least will take off some of that stress. But I'll just kind of highlight some kind of bigger things to think about if you do tear your ACL. So first off, you have to select your surgeon and what procedure you're going to get. So there's two general types of procedures. You have an autograft, which is like they're taking the tissue from yourself to replace the ACL, or an allograft is where they take tissue from someone else to replace the ACL. And in terms of the autograft procedure, they'll usually take from the patellar tendon, which is just below the knee, or from the hamstring tendon, which is in the back. So basically, there's pros and cons to each in terms of recovery time, potential complications, what the strength of the graft. And my general recommendation is to go with what the procedure that the surgeon specializes in. That being said, the only caveat to that is that with the hamstring procedure, you're taking away from something that really needs to be rebuilt. I did forgot to mention it into the other slide where there is a muscle firing issue a lot of times with ACL tears. So usually the quads will fire first, and that will cause the knee to hyperextend. And so or the hamstrings aren't firing when they are supposed to. So if you're taking away from that muscle that's already at a deficit, I wouldn't recommend that from a rehab standpoint. Also, another thing to consider is kind of to prepare yourself psychologically for what the recovery is going to be like. It's really important to put together a team, that being your surgeon, your physical therapist, family and friends that may have gone through it as well, or any online resources. This is something that I didn't anticipate tearing my ACL. It's so common that, you just didn't really think about it. But, I had to go to practice and just watch practice. So that really affects people's recovery time because they're almost too eager to get back and they may come back too soon. So again, if you're kind of preparing yourself mentally for what might be involved in your recovery process, not only the physical therapy aspect or the rehab, but just general your exposure, that's really important. A former teammate of mine unfortunately suffered multiple ACL tears, and she put together this group online called the ACL Club. I highly recommend checking it out because it's just a nice resource to kind of not feel alone if something like this happens to you or your child, and kind of ways to cope with the recovery. So just briefly going over the recovery period, current research, at least in 2016, said on average it's about 8 months, but it can be up to 18 months. And that kind of just depends on the individual, how many structures were injured. We talked about the unhappy triad, and also, what intensity are they going back to? Are they going back to their sport? So the biggest thing is you really have to avoid coming back too soon. So it has to be criteria based in terms of time based. So were those mechanics addressed? Are people symmetrically are doing the same thing on both sides when they move? Are is alignment looking good? Can they do it at game speed? So again, like even if it's 8 months, if these movement patterns aren't addressed, then you're not ready. So that's why I wanted to talk about that. It's so essential to have some kind of technique retraining, and that can be before or after injury, of course, specifically using the Alterg treadmill and functional training. So what is the Alterg? It is a gravity controlled treadmill. It's actually behind me over here. We have like a video of Dr. J with one of his patients working on it. It uses air pressure to unweight the runner. So unlike doing water running, which was very popular when I was recovering from my ACL, you can really control the amount of body weight. You also, that way you can recover or even train, at a higher intensity with less stress on your body. And that ultimately yields, like if you want to get your speed up and stuff like that, you're not stressing the tissues as much as if you were doing, fartleks or sprints like that I would do after practice sometimes, which I think ultimately caused me for, getting my injury. We also get a lot of valuable data when someone's on the treadmill, as such as, is there asymmetries in step length or cadence, and how much time are you spending on each foot? And we can track that. So it's a really valuable tool. I mean, I can't say enough positive things about it. We've helped so many people with it. I've had runners on there where, they were able to really increase and get better PRs, and or just people after injury just getting back to running. Again, when you get injured, the brain body connection gets damaged. So even running again will, feel a little different. So at least we can practice it on the treadmill and get that information, and you can relearn and enhance that connection from your body to your brain. And again, like I said, you can use this not even from a recovery standpoint or injury recovery standpoint, but just, improving your sports performance. Okay, so just wanted to show this video of what that kind of looks. So make sure it's at the appropriate speed. Okay, make this a little bigger for everyone so you can see it better. Okay, well now it's looking really fast. Okay, so you can see doc. Obviously, they have the monitor up here, and you kind of get that data we're talking about. We also, there's some video down here, so you can kind of happening at the foot and ankle, in terms of like, step width, getting the patient's getting that information. And so it's just so helpful because you see what you're, I didn't even realize I was doing that. Okay. All right, go on and then. So there's a lot of other tools other than the Altergy that can be really helpful in terms of your recovery and also just prevention. In general, and just avoiding that capacity intensity mismatch that we talked about earlier. You really have to include some active recovery, whether it's cross training, getting in the pool, such as getting in the pool, doing yoga, and getting on the bike. We all use this great tool in the clinic, the Hypervolt percussive device. I have one right here. So this uses percussion or vibration. I'll just turn it on so you can kind of see what I'm talking about. oops, here. So that way, in a shorter amount of time, you can kind of prepare your muscles for performance. It's also really helpful for muscle recovery. And so, again, if you're playing multiple sports and rushing here and there, I highly recommend it because that way, in terms of getting ready for your sport, you can treat yourself quickly. Also, in terms of like recovery, if you're like, okay, now I have to go home and study, you can do that while you're studying. So, I've just found it not only helpful as a clinician, but also for patients in terms of treating themselves easily and effectively. In terms of strengthening and preventing re-tears or tearing your ACL in general, there's certain muscle groups that should be focused on. So for example, your hamstrings, your trunk, and the hip abductors, which are on the sides of your hips, as well as like the internal rotators. Again, those are the muscles, if your leg is internally rotating, you want to be able to control that. And then flexibility important because these can all be extremely but if you're tight, it's not going to overcome that strength. So hip flexors need to be mobile. You can use the hypervolt for that. Obviously foam rollers, and doing some dynamic stretching, and adductors, of course, that's again, like I said about flexibility not overcoming strength, you can be really strong, but how you move is important. So I've had people test these muscles and they appear very strong, but when they move and do sport specific stuff, their legs going everywhere. So it's really important to include some functional training in terms of preventing, injuring yourself, whether it's the ACL or just anything in the lower extremity. So what is functional training? So functional training enhances the brain body connection. So again, like I mentioned, that gets damaged when you have injury, or if you have like a way you've moved all your life, it's really hard to unlearn that. So it takes a lot of rigorous practice. So even with a program that I'm going to talk about later in the presentation, it's recommended that it's done at least a solid 3 weeks before performance. So before like actually playing your sport. So that gives 3 to 4 weeks of doing this. Is it's really good for off season. You can do it in season too, but if you want the best effects, you really have to do this stuff early. And that's why I'm encouraging also to getting those sports assessments, because that way you can see like, okay, this is how I move specifically, and this is what I need to address. Again, like those muscle firing patterns, again, trying to get those hamstrings activating more before the quad do, just to avoid hyperextension. Using the hip stabilizers in a dynamic way or sport specific way. And then also just the foot and ankle. I know we talked a lot about the hip, but there can be some stuff at the foot and ankle, and that's why maybe the leg's a little unstable. So I'm just going to show you an example of just generally with functional training, you will start with something very simple, like a step down off of a step, and then do something more complex, and then bring it back to sport, because you really have to address those levels before you go to like sport speed or sport specific things. So we have a video of a patient of ours with Dr. Andrew. Let's see. So I don't have the video of her doing a lateral step down. This is more of the progression. So yeah, something a little more challenging here. So I'll make this big so everyone can see. So I think she's either a field hockey or lacrosse player. So these are positions that are a little more sports specific. She's getting down in a lunge. And so as you can see, we're kind of watching not only obviously the leg that slide happening at that left knee. Is it stable? This is obviously slow and controlled. So in the next video, what's important is you really have to, once this is looking really good, you have to bring it into more sport specific things. So Andrew's playing a little game here with her where she just has to go and get down with the ball, watching her knees, making sure they're not moving towards midline. We do other things too, in terms of like, things to kind of help people retrain this movement. So I don't know if you can see there, she has some tape on her knee, not necessarily as a support thing, but just to kind of give her some extra feedback in terms of where her knee is in the universe. Okay. Oops. Trying to switch this here. Really want to show you these videos here. Okay. So I mentioned earlier, there are some existing programs out there in terms of preventing yourself from tearing your ACL. So there's the shred neuromuscular training, and research has shown that that has decreased knee and ankle injuries by 36%. So that's huge because obviously this is relatively new. It hasn't been around very long, and obviously there's um, you know a certain amount of people that have been exposed to it so far. So I'm just going to share that link here to it for the PDF. And you can also, if you link, it's just going to be in the chat here. You can always call us. We'll do our phone number here. Let's see. So you can either call us at this number at our office. Again, we're located in the Madison YMCA, or you can go to playbetterwithpt.com or just shoot us an email because that way, even if you're not local, we can share this valuable information with you. So I did talk about the shred program, but ultimately it's good to have something really specific. Maybe you're not a basketball player, maybe, there's something unique to you that would be beneficial. So I can't say enough about sports readiness screens. So what exactly that is again, it's a technique assessment by a movement specialist, such as a physical therapist, to determine your susceptibility to injury. Also, in terms of enhancing sports performance, like if you move better, you're going to play better. So maybe you may not be likely to get certain injuries, but like, oh, you're moving in a way that's causing more effort than necessary. So we can help you optimize that. And then you get something individualized that can be helpful in terms of, again, preventing injury and maximizing your performance. The important thing is, say you can't see a movement specialist or you're uncertain, I just wanted to kind of highlight some examples. So I have a video of my niece, actually. She's going to be 13 in just a few weeks. So she's starting to heavily get into sports. I had mentioned to my sister, "Oh, hey, do you mind showing me, how Brooke's moving around and stuff in terms of jumping?" And so she took this video in their backyard, and it was extreme. I talked to her afterwards, and my sister was like, "Man, I had no idea this was happening," because obviously when you slow things down, you can really appreciate how you're moving. So if you're at home and you have one of those selfie sticks, or if you're the parent, just take a video of your child kind of doing some of these jumping maneuvers. Um, and what you want to look out for, let me just get this going, so she's doing a double limb hop. You just want to look at that knee window. So as you can see, as she lands, that knee window is really tight, especially from that left leg. So it's kind of coming into the middle. These positions are just really risky. So obviously this is just an example, and then obviously going side to side, and that way you can compare, between sides. So obviously I didn't assess my niece, but I would look at certain things in terms of her adductor flexibility and all those muscle strength things that we're talking about. And then we would probably train again at that, first level, make sure that these muscles are strong and then make it more functional. So we have another video of one of Dr. Miriam's patients that has been going through some training like this. So as you can see, let's get this big here. When she lands, her knees are tracking in line with her toes more or less. There's like a nice window between her knees. That's her, prevent those risky positions, as well as, she'll be able to jump with more power and just perform a lot better at her sport. Oops. So again, we created our own sports readiness assessment, and for a limited time, they're free this month, free in February. That's a $275 value. So we're only offering this for the remainder of the month. So I highly recommend either, again, going to playbetterwithpt.com if you'd like to register, or giving us a call. even if you're not local, we're happy to answer any questions that you may have. And speaking of, I'm just going to look in the chat now. I know that I forgot to mention that you can always put anyone that's live right now here. You can put some questions in the chat. This event was kind of a little last minute, so obviously, maybe if there's some questions and this is later, you can always reach out to us to those phone numbers. So a lot of questions I get is, what can I do in terms of, obviously my recovery? So I'd mentioned the hypervol. Yeah, rest days, they don't have to be lazy days, right? And so we're actually also starting recovery Saturdays, and you can come in and try these Normatec boots. Basically, they are wonderful in terms of recovery. Oh, sorry, I'm trying to get a picture of them. This way. Yeah, so basically, it's graduated compression, so just kind of enhancing blood flow for the lower extremities, and that's so important for recovery. So I highly recommend coming in and trying them out. Again, if you're local, just give us a call and we can kind of, even if it's not on a recovery Saturday, we can try and set something up. Again, thank you so much to More Sussex Sports. Thank you to everybody listening. We're here for you at Professional PT and Training, and have a great rest of your Saturday.